Hello, everyone. I'm Jeremy. I'm the Chief Digital Officer of the Johanniter, and my approaches, I'm looking for more patient-centric approaches, new business models in healthcare, and I've been with the Johanniter for 2 years, and prior to that, I was at the digital arm of Helios, which is one of the biggest healthcare providers in Europe, mainly in Germany and Spain with Quirónsalud. So I've got a question. Who is familiar with the German healthcare system? So the rest is not familiar or isn't just not responding. So Germany has really high cross-sectoral borders. So we still have a big problem, data moving between the sectors. And we are one of, I have to admit, the best healthcare systems in the world, in the analog world, but not on the digital world. So Germany is actually lagging behind. The Johanniter is one of the biggest non-profit healthcare providers in Germany. We have approximately 1/3 non-profit, 1/3 public, and 1/3 private. But there's actually no difference between the healthcare providers. It's everyone is suitable for every patient, and everyone can go to every hospital. So there's no separation between are you privately insured or not. So we offer the full care of services from birth to the end of life, and the full care of ambulatory and inpatient care. Especially also in the elderly care homes, we are one of the biggest providers in Germany. Our, and especially mine, biggest focus is, of course, on chronically ill patients, especially focusing on oncology, cardiology, neurology, geriatrics, and orthopedics as something as a high volume in Germany, especially. So something all over the world is happening, probably nothing new for you, but especially the German healthcare system is under immense pressure. So the costs are skyrocketing with an increasing amount of elderly, multi-morbid patients. And in contrast to other European countries, where you do not really have this high amount of cross-sectoral borders, you have really established care teams. We kind of spend almost double the amount of money for care, I have to say, excluding medication, but just for the care than other European countries, for instance, in oncology and cardiology. We miss care coordination, so every physician, independent physician, is treating the patient as he sees the patient, but it's not talking to the other physician. There's no communication in play. There's no proactive communication. There's actually no remote monitoring. And even if we think of telemedicine and we say, okay, even in Germany, telemedicine is increasing because of COVID-19, it's actually not really happening. The amounts are so low in contrast to physical visits. So this offers a high risk for patient complication along the patient pathway and reduced quality of life for the patient, because it's suffering to go from one doctor to the another, always telling the same story, and no interaction between the doctors. So one of our first steps is really improving patient care with establishing a patient portal. A lot of the people before me, a lot of the speakers already have done this. So this is something even in Germany quite new. We have a Hospital Future Care Act where the hospitals receive 4.3 billion euros. But the truth is it's only into hospital digital infrastructure. It's not really improving the healthcare system. It's just to getting, again, competing with other European countries. So, of course, we start with the usual services. Everybody knows with our outside healthcare, with providing options, providing infos, options for appointment booking, options for downloading and uploading patient data and patient files directly into the hospital information system, which is often especially rigid. And then the goal is to integrate new care models already established, but in one portal, because now it's a satellite way, so the patient needs to install different apps, which we want to have a single point of contact. So focusing on telerehabilitation, telemedicine, remote patient monitoring, and transform it to a real platform. And it helps us to improve and provide new patient pathways. The goal is to provide core services we already established in the analog world and put it into the portal to create the platform and to establish what we have in the analog world and transform it also into the digital world. So it's about diagnostics, diagnosis, treatment over telemedicine, teletherapy, patient monitoring. We cooperate with industry partners to establish lab-at-home tests and really immediate blood testing, for instance. And also want to partner with third parties when it comes to medication delivery. And the thing is, the Johanniter are very trustworthy with a high trust brand in Germany, and we want to establish a single point of contact. And there was a question asked by Roland Berger when it was, who do you trust with your patient data? It was like 55 to 60% said with my usual providers, so my primary care physicians or hospitals, and not with big tech or big pharma or big medtech. So our goal is to establish a real virtual clinic. We are in Frankfurt. As you might note, the federal state, Frankfurt is the capital of, it's not the capital, but the biggest city is Hessen. And there was a survey that asked the primary care physicians in Hessen if they orientated and always follow guideline-orientated healthcare. And 65% said we neglect the guidelines. As you think of cardiology, you have like more than 1,000 pages long of guidelines only in cardiology, updated every 5 years. So it's, on the first hand, they say it's kind of impossible, and then the other part is they have full room, the waiting room is full of patients, and they really need to treat the patients, and they go just from the gut feelings, how they treat the patients or how they in the past have treated the patients. So our holistic approach is from a single point of contact in close coordination with primary care physicians. And we want to really focus on that we establish with a virtual clinic that the doctors treat the patients in immediate care. We want to focus on long-term behavioral change with therapists and coaches. And the goal is to really reduce hospital admissions, increase the quality of care, and reduce costs through a better adherence. So especially when we focus on behavioral change and lifestyle. Patients go on a regular basis in Germany to the doctors. The doctors, for instance, in cardiology says, have you reduced your salt consumptions, reduced fat, reduced alcohol, stopped smoking, and went on doing sports? And the patient is saying, yes, of course. The doctor says, you're lying, or thinking of you're lying. And this is kind of the usual phase every 3 months they are doing with the same patients. But the thing is, patients do not understand. They are not helped while not in the facilities, and this is something we really want to foster on long-term behavioral change and do addition to the traditional healthcare. So we really coordinate or want to become the coordination between the different care teams, and also send notifications to the care teams and send notifications to the doctors. So how does it look like? The primary care physicians or the hospitals identify potential patients suitable for such a program. The patient receives an onboarding process, the education, and receives the medical devices, because the medical devices need to be issued to the patient. Can be just a usual smartwatch nowadays, or can be even more sophisticated medical devices. The data of, for instance, especially the watches are analyzed through medical algorithms or with other devices through thresholds, and video chats can be booked or can be booked if, for instance, if you think on cardiology, the patient has an arrhythmia and needs to check in with the physician. So the medical therapy can be adapted by our doctors in close coordination with primary care physicians. And we also take care of the patients, still do their quarterly visits. So it's really an add-on to the analog healthcare system with a focus on reduction of hospital admissions, because then the really cost cuts come in, and unnecessary doctor visits, which are for specialized physicians who only get paid quarterly, is something they are really in favor of. But we are not doing this alone, so we established together with our partners eAtros a joint venture to really approach our care model of a virtual clinic arm with our new brand of the DH22 Telemedicine GmbH. And the first indications are, of course, in cardiology, because in cardiology we really have now established a patient monitoring reimbursement, but only for heart failure patients. But we also want to expand this to all the sub-indications and side indications through integrated care contracts. And we are also on our way to establish this in oncology as our next step when it comes to care, also with the side indications of diabetes and COPD. So I thought I only had like 15 minutes, so The good thing is I thought about blowing up the presentation or just going with my 50 minutes. So if you have questions, I'm happy to answer them, as I still have 7 minutes left or something. Otherwise, you have another coffee pause, a coffee break if you want.